You will die sooner than you should if you rely blindly on the U.S. healthcare system. That's not hyperbole, that's math. Because in this system, designed for profit, not prevention, the passive patient gets buried in paperwork, misdiagnosed, overcharged, and often overlooked. So if you want to live longer, stay healthier, and avoid catastrophic medical mistakes, you need to become your own fiercest advocate. Here's how to do that, step by step. 1. Understand this. The system is not set up to save you. Let's get brutally honest. The American healthcare system is the most expensive in the world and ranks dead last among high-income nations for outcomes like life expectancy, chronic disease management, and maternal health. Why? Because it's fragmented, opaque, and profit-driven. Doctors often have 10 to 15 minutes per patient. Insurers gatekeep every test, treatment, and prescription. Hospitals charge wildly inconsistent rates for the same procedures. And the average person is left to navigate all this in a fog of confusion, fear, and rushed appointments. So rule number 1, stop expecting the system to catch your problems. You have to catch them. 2, get your full medical records and actually read them. Yes, you're legally entitled to your complete records, not just test results, but clinical notes, imaging, and doctor impressions. Go to your provider's online portal. If they make it difficult, file a HIPAA request. Then do something radical. Read your own chart. Look for diagnoses you weren't told about, labs that were labeled normal but sit on the edge of dysfunction, medications listed that you're no longer taking or worse, never took, flags like elevated liver enzymes, borderline glucose, or low iron that no one followed up on. You wouldn't believe how often errors, omissions, and oversights appear in records, and they compound over time, especially when you switch doctors. 3. Don't accept normal without context. One of the dirtiest tricks in modern medicine is using the word normal without defining it. Your thyroid might come back normal, but your TSH is 4.4, and you feel like a corpse. Your B12 might be normal, but you're at 310, 1 point above deficiency, and your hands are tingling. Demand numbers, ask for reference ranges, track your trends over time. And remember, normal is a statistical average, not an ideal. You're not trying to survive, you're trying to optimize. 4. Bring a written agenda to every appointment. Doctors are rushed, they forget. You forget. Then you walk out with 6 minutes of vague reassurance and 0 answers. Fix that. Before every appointment, write a concise list of what you need, what symptoms you want explained, what labs or imaging you're requesting, what side effects you're noticing, what medications or supplements you want to revisit. Keep it short, bullet points, 1 printed sheet, and if the doctor starts to derail or rush, bring them back to your list. This is your health, not a social call. 5. Understand your labs better than your doctor. You don't need an MD to know what a ferritin of 10 means, or that your triglycerides shouldn't be 250, or that low vitamin D isn't just fine if it's over 20. Modern healthcare assumes patient ignorance. Break that assumption. Use tools like labtestsonline.org, Found My Fitness, Doctor, Rhonda Patrick's Breakdowns, Examine.com for supplements and biochemistry, forums like Reddit's Ask Docs for second opinions. Then build a personal dashboard. Track your numbers like your life depends on them, because it just might. 6. Ask the question that stops everything. What else could this be? This phrase changes the tone of any medical conversation. I understand what you're saying, but what else could this be? It forces the clinician to think wider, to consider differentials, to double-check their assumptions. You're not doubting them, you're engaging them. And you'd be surprised how many missed or delayed diagnoses, from autoimmune to cancer, could have been avoided if someone had just asked that question sooner. 7. Insurance companies are not your allies. Your insurer does not care about your health. Their job is to pay out as little as possible. So when they deny a test, prescription, or scan, appeal it. Every time. Ask for the denial in writing. Call and request a peer-to-peer review. Use the magic words, "I'm requesting a case manager," or "I'd like to file a formal grievance." Don't be afraid to escalate, and keep a written record of every phone call, who you spoke to, when, and what was said. 8. Build your health cabinet. No one person can cover all angles, so build your cabinet. A network of trusted voices and references. Include a primary care doc you trust or tolerate, but who listens. A functional medicine doc for root cause analysis. A pharmacist for drug interaction checks. A sharp nurse or physician assistant friend, priceless for insider insight. A go-to health nerd in your circle who reads medical journals for fun. Yes, they exist. You want diverse perspectives, because the truth is rarely one-dimensional. 9. Second opinions save lives. Always get one. If you're given a diagnosis that requires surgery, long-term meds, or invasive testing, pause. Get a second opinion, then a third if needed. Good doctors welcome second opinions. Bad ones guilt you for questioning them. That's your litmus test. 10. Keep a personal health timeline. Start a private document, Google Docs, Notion, whatever. Build a chronological list of major diagnoses, medication changes, surgeries and procedures, lab anomalies, life events, stress, trauma, moves that impacted your health. Over time, this will become your North Star. Doctors will thank you, and you'll finally see the patterns others miss. Final thought. You are the CEO of your own health. Not a passive bystander, not a confused passenger. A CEO. That means you hire and fire your doctors. You approve or reject treatment plans. You allocate time, money, and energy to what actually works. No one else will take this seriously for you. And in this broken system, waiting for help is a death sentence. So get fierce, get informed, and become the kind of advocate your future self will thank you for. If this opened your eyes, share it with someone who's been steamrolled by the system. Leave a comment with your own medical horror story or your success story. Because this is how we take our power back, together and awake. And remember, the most dangerous patient is the silent one. Thanks for watching, and we hope you got some helpful info. Remember, take care of each other and be well.